I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with the Whitford Thomas Group. Today we're going to speak to you about the types of severe depression. Interestingly, most depression is fairly severe. As far as a label or a diagnosis, when we think of severe depression, we're usually thinking about major depression. And what's the difference between major depression and other depression is the symptoms tend to be very similar. And the symptoms associated with depression, because depression tends to be driven by thought, the types of thought that drive depression are a sense of hopelessness and a sense of helplessness. The hopelessness is that things are not going to get better, and the helplessness is there's not anything I can do about that. So one of the symptoms associated with depression is this kind of lack of motivation, lack of energy, inability to concentrate, poor appetite, insomnia. Those tend to be the fairly common symptoms of depression. Now, how does that play out in a major depression? Is people who are depressed oftentimes still function. They still go to work, they still interact with friends, they take care of their children, things of that sort. With major depression, oftentimes people need to be hospitalized. You tend to get a much more higher incident of suicidal ideation, with some folks even suicide attempts. Oftentimes with a severe or major depression, people begin to not take care of themselves, begin to isolate a lot more, hibernate if you will, not get out and take care of other obligations, be it social, vocational, things of that sort. So severe depression tends to fall in the area of major depression, which the symptoms tend to be much more elevated and produce more maladaptive behavior. And probably the most dangerous component of a major depression is it tends to be a much higher incident of suicidal ideation. I'm Dr. David Thomas, speaking to you today about severe major depression.